purpose to see the Mermaid Lake, and Al Reese, who owned most of the lake, was just, he wanted to subdivide it into areas so that was people who would preserve the integrity of the lake. So he made it so the lots aren't quite big enough to subdivide because you have to have 200 feet of frontage. And he sold it to us on a land contract at $20 a foot frontage. Couldn't touch it now for probably $200 a foot frontage.
Wow.
Right time and right place, you know.
I was going to say right time, right place.
Yeah, exactly. I've been here most of the summer, so I think we came home for 4 days on 2 different occasions because Tom had doctor's appointments.
Ah, okay. But you spend quite a bit of the summer up there.
Oh, yeah. We don't come up in the winter. We used to years ago, but he had after he had his heart attack, he's not supposed to shovel snow. And even if we get our driveway plowed, they get so much snow up here that we just don't even come up in the winter.
Just a reminder, we are live. We're gonna do a sound check.
But you spend quite a bit of the summer up there.
Oh, yeah.
Hello, everyone. This is
Hi,
Hello,
Angie.
Angie. Hi, Angie.
We'll officially introduce you, Ms. Moraski, with the Board of Health, but this is our newest board member who is joining us today.
Hello.
hello, Jen.
Hi.
Good to have you aboard.
Thank you. It's nice to be here.
Don't we have someone else on there tonight too?
Ms. Tarina, Alderman Tarina will start. The board will be finalizing her appointment on Thursday.
Thursday? Okay. Sounds good. It's nice to have some new members.
Jennifer, are you related to Kathy Borowski at all?
No.
I went to school with her, so I was just wondering. It's an unusual name. So,
Yes, different spelling on that one, I believe. I get that asked that all the time.
yeah.
Okay, it's officially 6:30 p.m. on July 20th, 2021. Do we have any guests or public participation for this meeting?
No guests today.
Excellent. Then we just need approval of the agenda for July 20, 2021.
Move
I have
approval.
one amendment or adjustment. I'd like to move the public administrator review to executive session at the end.
Okay,
I move approval as amended.
Second.
Okay.
any discussion? All in favor, say aye.
Aye.
Hi.
Excellent. Approval of the minutes from June 15th, 2021.
Accepted.
Second,
Second.
excellent. Any discussion? All in favor, say aye.
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 Hi.
Excellent, excellent. COVID-19 local perspective update.
Good evening. Happy to provide an update. I'm going to do kind of a quick, I'll go through this pretty quickly. And I apologize, I do have a dog that might be barking in the background occasionally. Let me share my screen. Are you able to see
Yes.
the
Yes.
slide deck?
Yes.
Okay, good. So, apologies again.
That's okay. My dog's listening to her.
I realize multiple people have dogs, but it's annoying. Hang on, just. Jake, okay. May go even faster. So the data is always going to lag by, we're always reporting on the prior month. Okay. And so this is going to focus on June. And our numbers will really looked very good in June. And I know we're all aware that there's increases in the state and in the county and nationally right now. But most of what I'm going to be reporting on is sort of what the picture looked like in June. And just for a little bit of context, back in November, which was when the biggest peak came through, we were seeing over 230 cases a day. Last month in June, we were averaging just 10 cases a day. So the numbers really looked pretty positive. Along with the national trend right now, we're seeing numbers that are trending higher than certainly than the 10 a day, but we're more in the 20 range, not anywhere near where we used to be. So while we've seen the number of cases going up a little bit, we've seen the positivity rate going up. In June, things looked very steady. This is sort of an overview from the CDC's website. And basically back in May, you can see there was a lot of red in the state, a lot of higher risk. Things looked much calmer in June, and now currently we're seeing a little bit more red coming back into the state, particularly in the west central and southern, more towards Missouri. I'm going to be skipping through some of these slides. On this one, all I really want to call out, again, we've monitored this throughout time. This is looking at the infection rate. Again, last month it had dipped down. Now it's coming back up again a little bit. Just coming out of the green range for Winnebago County. Skip this slide. All I want to really call out on this slide in terms of the volume of testing is, again, you can see how just the testing volume has just dropped and dropped and dropped. Some of that was reflected in the lower case volumes, but also fewer people are being tested. Coming through June, schools were out. And so, any testing was being done there was reduced. I'm going to skip this slide and we're going to come. Again, we've shared these before. The really thing to call out is, once again, it's sort of, this is the cumulative case of counts. Last fall when we went through the huge increase, we had another increase late winter, but the top of this is really flat right now. And that, again, is showing that we had a really stable month of June in terms of the counts. Again, you see it in terms of cases and onset, shorter peak, and then we've come out of that. This is a summary of the variants right now. Again, we've seen a steady increase in the number of variants. The B117 is the most common, but it was most common because that's what was prevalent and present in the community prior to this most recent uptick. As of when we ran this report about a week ago, there were only 5 cases of the Delta variant. I know now the Delta variant is becoming more common. Certainly, you see all the headlines nationally. We're seeing more of the Delta variant here. It's still not dominant by any stretch, but those numbers are increasing, and we suspect that they will continue to increase. And we do see the greatest number of variants in that sort of that teenager into young adult age band. I'm going to skip this slide. Now we're on page 13, the second slide here. Again, the only thing to call out on this, we're monitoring the age distribution of the cases month by month. We do see a sort of a big increase this month as cases in the 20 to 29-year-old age group. That's where, again, the vaccination rates may be lower, they are out and about, and they are at risk. And we're seeing that reflected in the data. I'm now going to skip about the next 6 slides. They're really sort of the case demographics. We look at these every month, And there is minimal change month over month in these. So I'm going to skip through sort of the race and ethnicity has not changed. The age bands and race have not changed. The outliers of the Latino population in terms of seeing a much higher case rate is consistent, and those same ratios are maintained. Age and gender, death by race and ethnicity, these are all really stable over time. In terms
Do we
of
have
death
an
and
idea of the vaccination rate in Winnebago County?
Yeah,
Overall numbers, Dr. Williams, yeah, we're at 42% fully vaccinated. And in our youth, it's 30.7. Yeah, we're not doing too well in that area. We just looked at it today for, continually look at it. But yeah, we are probably not performing as well as other counties with that have higher. I think Lake and DuPage are battling it out for first overall, but we are lower in vaccination rates than Cook County. And that's a
yeah,
concern.
right now DuPage is around 55% and Lake is around 51% in terms of fully vaccinated. And I can give you a little more information on that. Again, these are slides that we've looked at before, no real change. The only thing to look here again is the region was impacted in terms of availability of the ICUs. As the cases dropped in June, we saw a little more capacity opening up, but it's still really tight. And as of today, I think we dropped below 20% again on ICU capacity. So it continues to be a challenge. Every month we touch base on communities of concern. In this case, there was not even any changes in what the top 5 zip codes were. So those same areas have been impacted. Schools are not in session, so we're really not seeing cases or outbreaks in schools, but if school-associated camps and things like that could be a source, and we are certainly monitoring that. Getting to the vaccinations, as you were asking, the number of vaccinations per day, they peaked, back in March, April, and then started dropping in May. The numbers are very low, relatively low now, certainly compared to where they were. It's slow improvement on the percentages. And yes, and of the elderly population, we're showing 76% is fully vaccinated. A little bit more about vaccinations. This chart really does show how the volume of vaccinations per week through the health department has declined from a peak of over 11,000. Now we're running down in the lower hundreds of vaccinations. The Sandy Hollow vaccination site closed. New Zion served as a site through the end of June. We're now doing vaccination clinics at the health department on Wednesdays and Saturdays by appointment. We're doing a number of pop-ups and events, and Rebecca or Dr. Martell can provide a lot more color commentary on on those activities. But the focus really is on getting out into the community, working with schools. A number of the schools are doing vaccination events this week and next, I believe. Last week they also had them. But they're much smaller sites and lower numbers. I'm going to skip through this. This is looking at congregate settings, very stable, no real change. Deaths, we saw the increase from facility-based to shifting to more being people in the community, but that has continued. It's stable. The causes of death and comorbidities, those numbers and percentages remain unchanged. There were only 4 deaths in the month of June, so these pie charts won't change very much from that. Similarly, where did you get exposed to COVID? most of that is unchanged and stable. And I guess the only other last couple slides that I have are relative to the risk metrics. This is the state's dashboard. And the nice thing is this was as of really the end of June, beginning of July. There are a lot of blue in the states. The counties were not warning. And for the first time in many months, Winnebago had 0 indicators of warning. So that was a good thing to see. And again, looking at the region, the positivity rate has been coming up a little bit. The capacity of the ICUs has been kind of a challenge. We've run right around 20%, which is the trigger point. Usually we've been just above it. Today we're below it a little bit, and tracking the hospitalizations. And those are really, that's the end of my update. I don't know if there are questions though.
With Sandra, what is the consensus about the schools with masking versus not masking? Is there's conflicting reports in the media and school policy about vaccinations?
Okay, so unfortunately, the way interpretation of the CDC guidance as a recommendation seemed to imply to some in the population that masking was optional. There is no mask mandate in the state of Illinois. The governor has come out and said it is under local school board control. So the challenge we have is, you know, that layering of mitigation. And I'm happy to share with you, let me bring this up. Give me a second here. I'm going to have to share screen.
Stop, Peter.
Pardon?
Peter has to stop sharing first.
Okay. And so Dr. Williams, in preparing for this and recognizing that this was coming down, what I started to do was help develop a tool for our school boards to really start looking at how do you apply all the mitigations, right? Because we know there's tremendous, I'm going to say, pressure on the schools not to mask from a small but vocal group. And so the challenge has been, and I'm going to bring this up in just a minute here. I apologize. And so I put together just a way to weight it so that when school boards were looking at what mitigations would they put in place so that they could reduce the risk of transmission. So, you know, on top of masking, you have social distancing or physical distancing, right? Last year it was 6 feet. Now it's 3 to 6 feet. You can still cohort. There is testing available now. You can do screening testing, meaning you're regularly testing those that are unvaccinated on a routine basis. Kind of, we would call that surveillance in public health, but certainly screening for that. In addition to, you know, your typical hand washing, isolation when ill. And so, give me a second here, and I apologize. I need to. All right, so I'm going to share my screen. Okay, can you see this now?
Not yet.
Not yet.
All right, hold on.
Oh, wait, you're starting to share now. There you go.
A little bit of bandwidth. Okay. So this is kind of the preamble. If you were to look at, when we looked at data from last year, just so everyone's clear, about 1/3 of our cases were in elementary or kindergarten, right? 46% were in that high school range, which is consistent with what Peter's reporting, right, in the data regarding that we have in the new cases. So the benefits of in-person, you know, we talk about face coverings, frequent hand washing, and sanitizing, aggressive contact tracing, exclusion of sick or ill, providing access to rapid testing, cohorting, maintaining 3 to 6, as well as maintaining vaccination of eligible individuals. So what I did was start to work with, and you can see it's still kind of in some of this, was started working with the superintendents along with kind of weighting some of these, so that the goal was that if I could get schools to get closer to the score of 30, that we might be able to take a look at reducing the transmission. And it's a combination, because you have to layer these mitigations, right? And if there's an outbreak going on, then you have to add additional mitigations. If things improve, then you can pull back on some of the strategies. So for instance, if you wanted to do universal masking, and there's discussion, I'm working with the state more on this, of whether it's 15 or 10 points. Masking of unvaccinated students and staff was given a point value of 5 or 10, to just know that we're working on this. Vaccination rate of 70% or higher gave the highest point value, obviously at 25, and that's what kind of is the predictor on herd immunity right now and the best science evidence we have to date. If you got to 3 feet of social distancing, it was a 5, but if you could do 6 feet, it could be a 10. Cohorting of students and associated staff, which you can see being done in the younger grades, meaning that the school, the teacher, the aides stay together throughout the day. They go off for recess together, they eat lunch together, similar to what we did last year, was a 5. If you had a school associated contact tracing team, you got a point value of 10. And I said, this is like your attendance grade in school. Like, this should be an easy one for you because they did it last year. There should be an easy way for them to get that number. And then weekly testing or screening of unvaccinated staff and students would get a point value of 5. And then an HVAC system compliant with ASHRAE guidance. And so that had come out, you have to have a MERV filter rating of at least 13. You have to do X number of air exchanges per day. Some schools can do this, some can't. So that it gave some ability for school districts and school boards to say, what could they do? The idea was that we were going for a score of 30, right? A relative value of 30. So if you had 70% vaccination, if you as a school board said, we're going to ask students their vaccination status and staff, and if we get to 70%, you got 25 right out the gate. And again, I always say this is your attendance. Most of our schools already had school associated contact tracing teams that worked aggressively with us, and Todd Kisner can speak to that a little bit. That should have been, where, but if you want to go unmasking, you're going to have to increase your mitigations. So while we don't, the current recommendation, highest level guidance is still to recommend masking of unvaccinated individuals. We are recognizing we're probably going to have to help groups work through that layered mitigation, because many of them will not be able to pass that in their schools. So looking at how can we do the, again, the best value. I want to be also clear, this is not a recommendation, this is not enforceable, but what becomes enforceable, the couple of things that go on. One, in the event of a disease outbreak or communicable disease, then we fall under the public health code, right? Under the communicable disease code. And then we may have to apply additional mitigations and layers on that. So that, for instance, if there's an outbreak and you haven't been masking and you haven't been maintaining 3 feet of social distancing, we may have to put mitigations on you regardless of what your school board may have selected under the public health code. But again, the idea was that we wanted to give school boards some ability to take a look at this and what could they do within their schools. I have schools that can maintain 6 feet of social distancing. I have a couple of schools that think that they can get up to 70% in vaccination, despite the fact that I've given you some low numbers in the other grouping. I have some that have the HVAC systems that are compliant already. They worked on that last year and spent their COVID dollars on that. So again, it allows them to put together what they can enact at the local level and give some authority back to them. But you're seeing a lot of debate about unmask our children and things like that. So, again, open discussion on this. We are not mandating any particular. What we're saying is this is the best practice guidance that we can get to prevent the transmission of COVID-19 in the school environment. And And again, we ask that the layered mitigation be communicated to families and students so everyone's aware, as well as to share with us what they're doing. So in the event that we have cases or an outbreak, we know where we need to start working on immediately, because that's going to be, was so critical to us last year in the school environment, was that, you know, very close working relationships so that we could quickly isolate and contain those individuals that were impacted. So that's been the discussion and the debate. I know that the state will not be issuing mandates related to the school environment. They've made that clear. So they've left it up in, I'm going to say local authority. When I say authority, a local control under the local school boards, and then in partnership with the health departments. We took an active, proactive approach with our school board, our school, like Regional Office of Education and Superintendents. We've been working on this since, I want to say, back pretty much after the end of the school year, and started planning for the start of the next. So we're tweaking it a bit. I know there's many of them are meeting with their school boards this week. Our first schools will roll in the next, I want to say some of them start as early as August 8th. So we needed to get moving on this so that they could give direction to their students and families as they return to school. And we held the same meetings in terms of the regional office, hosted both, what I would say, meetings with both public and private, right? Understanding that private also have different, you know, standards as well. I mean, but the idea being is, how can I have them look at guidance in a way that they can select the options that will get them as close as we possibly can to what we think will reasonably reduce the transmission.
Okay.
Can I ask a question? What would constitute an outbreak?
Well, Todd and I were just on a call this morning. Right now, it's 5 or more linked cases, but they are going to, my understanding is, we heard on a call to drop it down to 2 or more linked cases. And remember,
that they need to be linked to each other, not to home or something like that?
Correct. So it had, in some way, like Pat, for instance, 2 children in the same classroom, 2 children in the same extracurricular activity. And it could be a staff and a student. It could be 2 individuals. So, you know, it could be 2 that ride on the bus together. And again, in the school environment, it's not the 2 that have a sleepover on the weekend. Okay. And so we know that there was a lot of discussion about the extracurricular activities, and most of that occurred last year. But now that we're moving more students into the in-person environment, right, we're bringing back, you know, the hybrid is, you know, instead of 50-50 or blue and gold days, and we had, you know, because they were maintaining the 6 feet, that will probably be less likely. And we'll, you know, again, this is part of that, why monitoring is so, you know, critical to that. And you can imagine they're struggling through this decision-making process. And again, another phase of the pandemic where, again, we've moved through kind of the individual choices versus to, you know, what is the collective group going to pull through. So I know that one of my Winnebago districts has met last night about what they were going to put in place. The Archdiocese has called me about what they plan to put in place, with the idea that, you know, I'm going to say all the schools really want to make sure that the children are returning to the educational environment in as safe a way as possible.
Okay. We have the official welcoming of Jennifer Moraski. I think she briefly popped up on the screen. Congratulations, glad to have you on the board. Look forward to your input, and one of these days we'll have meetings actually in person.
Can you not see me?
We can see you now, but if you don't
okay.
talk on my screen, you like pop away.
Gotcha. Well, thanks for having me. I'm looking forward to immersing myself in this process. Very interesting.
Can you give us a little bit about your background?
Sure. I was born and raised here in Winnebago County. I've been a funeral director embalmer for over half my life here in Winnebago County. I own Moraski Monument Company and Adept Funeral Staffing Solutions. My father, my mother, both from here. My father is a retired Swedish American doc, internal medicine. I am current chair of Winnebago County CASA, thanks to my mother, who was a CASA for 25 plus years of her life. That term ends in October, but it has been an amazing experience. I've been part of CASA now myself for 5 years, give or take. And I just look forward to really getting into the nitty gritty of what's going on in our community. I worked for a funeral home for 20 years and didn't have much time outside of working to do those types of things. So now that I am working for myself, I want to get more involved in the community. See
Excellent.
how I can help.
Well, again, thank you for accepting and being on the board.
Thank you.
Maybe Dr. Williams, we could have everyone at least do a brief introduction to who they are and if they're a staff or a Board of Health member, and maybe a little bit, I'm going to say the 50-second elevator tour.
Okay, well, I'll go first. My name is Dr. Alan Williams. I'm at Swedish American Hospital, primary care, internal medicine. I can't remember how many years I've been on the board, but not as many as some. And I'm the current chair.
Mr. Powers, maybe? I'm going to just call you out.
Right. I'm Jim Powers, retired from a career in the not-for-profit sector and from the University of Illinois College of Medicine in terms of doing research. Been on the board, I think it's going on 20 some years.
Wow.
Lucy Hoover.
Gotta take it off unmute there. Can't hear you, Lucy.
You're muted.
I did that because my dog was barking. My name's Lucy Hoover. I'm a retired paralegal. I had been with Hinshaw and Culbertson. I think I've been on the board, I don't know. Pat Lewis and I have been on for, it seems like forever, and I'm a member at large. And I currently serve as the personnel chair.
Jim?
Hi, I'm Jim Keeler. I'm the finance director here at the health department. I've been on board about 2.5 years and spent most of my life in the southeastern Wisconsin area and northern Illinois.
Meet you.
Mr. Gottschalk.
I'm a retired lawyer from the General Counsel's Office, United States Department of Agriculture in Chicago, and moved up here in 2006. Let's see, I'm the chair of the policy committee. And like everybody else, I don't remember how long I've been on, but not as long as most.
Mr. McCreath.
I'm Bob McCreath. I'm retired from Ingersoll Milling. I've been on the board for 4 years.
Cheryl.
Never find that unmute. Hi, my name is Cheryl Floyd. I'm employed at Winnebago County Health Department. I'm the director of the Center for Health Promotion and Wellness, and I've been employed here. This will be 24 years, and I'm from South Carolina.
Dr. Helen.
Hi, been on the board for about 16 years, veterinarian here in Rockford. I sold the business on May 25th, and they instantly hired me back as a consultant. So I'm as busy as ever. I was president of the board in 2005, I think. It's been quite a journey.
I bet.
Christina Washington, known as Katie O'Toole there.
Hi, yes, I'm Christina's account, so we can host the meeting, but I'm Katie O'Toole. I'm the Director of Communications, and I've been with the Health Department for 3 years.
Mindy?
Hi, Jennifer. Nice to meet you. My name is Mindy Idell. I'm the director of the Personal Health Services Center, which is the clinical stuff. I'm a nurse, and I've been at the health department, gosh, I think 4 years, maybe going on 5.
Cynthia.
I'm Cynthia Hall. I'm the Director of Strategic Initiatives. I'm currently working on the Joint Information Center for COVID response. And in 4 days, I will be here 4 years.
Congratulations.
Thank you. Welcome.
Thank you.
And our attorney, Lafacaria Vaughn.
Hi, I'm Lafakiria. I'm the chief of the Civil Bureau for the State's Attorney's Office. I've been with the office about next month, it'll be 6 months. Prior to that, I was with the city of Rockford for 7 years.
Peter?
Hi, I'm Peter Lupayton. I'm the Director of Data and Quality. So when you get bogged down in the numbers, that's where you'll find me. I've been with the Health Department just about 2 weeks less than Jim Keeler, so just a little bit over 2 years. And welcome aboard.
Thank you.
Todd Kisner.
Good evening. I'm Todd Kistner. I'm the director for the Center of Health Protection, which deals with all the communicable diseases. And I've been with the Health Department 18 years.
Dr. Lewis.
Nice to have you, Jennifer. I am Pat Lewis. I am a retired nurse, retired from University of Illinois College of Nursing, and I wasn't retired when I started on the board. So that tells you that I've been here for a while.
Todd Marshall.
Hi, Jennifer. Todd Marshall, Director of Environmental Health. I've been here for 26 years. Have several licenses, including the licensed environmental health practitioner, oversee food programs, water, wastewater, mosquitoes, housing, lead-based paint, about everything under the sun for environmental. So
sounds like it.
Yeah.
Rebecca.
Hi, I'm Rebecca Lyons. I'm the newest director, I believe. I will have been here a year in September. I can't believe it's been that far. I'm the crazy person that joined during a pandemic, but it's been really rewarding. I'm mostly the planning section chief for COVID, and any questions, COVID vaccine, I'm your person for that for now.
All right.
Angie, I know you're on the phone, Angie, and can see us.
I can see every one of you. You all look so pretty, also colorful tonight. Jennifer, I'm on the Winnebago County Board, and I've been on the department board for probably about 14 years, I believe, something like that. And they can't get rid of me. I like being on this board. I just found it to be one of the most interesting and the most useful thing that you can do is to be on the health board. So welcome. I'll be seeing you around too at the I believe our meeting probably coming up Thursday night. And again, you won't see me, you will hear my voice.
Okay. Okay.
No, I think I go live on this Thursday. I can't now. I'm between Zooms and live, so it's kind of hard to figure out what night I'm going to be where. But congratulations and thank you for volunteering to be on our board. Thank you.
Thank you. And good to meet everybody. And thank you for everything that you've done all along in your time on this board. I look forward to learning more.
Excellent. Ooh, okay. We have an iPlan meeting next Tuesday from 5:30 to 7 via Zoom, correct?
Correct. It was just a reminder there, so you could. And I know Lafacuria is going to give us a little update about moving to in-person meetings for with the suspension of the executive orders of the governor. Do you have any other additional updates?
Thank you, Dr. Martell. So Dr. Martell did forward me the policy that you all passed regarding remote attendance. That's kind of, it's called under OMA. So if you would like to attend a meeting, a public meeting virtually, you have to follow the policy and the procedures listed. There's only certain exceptions under the policy for you to appear remotely. And the members that are physically present at the meeting location have to vote. It has to be a majority vote. And that is consistent with the Open Meetings Act, and that is how the county board plans to move forward with their meetings after the disaster declaration expires. and it is set to expire on July 24th. Pursuant to the governor's last order, he said he does not plan to extend it, but we shall know in a couple of days.
Okay.
I think long and short, we should be planning to meet in person. And I will send over our policy, remind everyone, it's been a couple of years when that you put it together and we put it officially in writing and the board approved it. So that just a reminder so that we can pull that together. A quorum needs to be present physically for the group to proceed.
Excellent. Now to Finance Committee.
Okay.
John. Oh, there you go.
Dr. Halverson isn't here, so Mr. Powers, you want me to kind of help you through this?
Well, before, Jim and I have teamed this before, so I guess we will team this tonight. I will start in. We have several parts to this. The first part has to do with the approval of the minutes, which there are none because we were not able to meet. The second part is in terms of our financial statements, and I will do the first part, which has to do with the resolution of expenses, and then have you pick up, Jim, and do the rest of the financial statements. Does that sound okay?
That sounds perfect. Be happy to do that.
Okay. So in terms of the resolution of expenditures, the expenditures for this month are $896,397.84. Do I have a motion to authorize those expenditures?
Don't move.
Second.
Have a motion and a second. Any discussion? All those in favor say aye.
Aye.
Any opposed? Okay, motion pass. Jim, why don't you pick it up for items B through G?
Okay, on page 25, we have the statement of fund balance. And for the month of June, we actually had revenues with the real estate taxes of $1,475,397.99, and then the said expenses there of $896,394.84. So our current fund balance is $10,372,864.64. So the year to date, we've had a decrease of $360,535.79 in our fund balance. But last period, we were running a deficit of $939,000. So we had much improvement this month. The next is our financial review, where we kind of say where we're at with our current budget. We're in the 9th month of our county budget, and we finished up the 12th month of our Illinois current fiscal year. So, so year-to-date revenues at this point should be per plan of $10,787,250. Actually, they were $8,477,141.34, which is a variance of $2,310,109. With the expenses, we had budgeted at this point $11,154,275.25 in expenses. The actual and encumbered were $8,837,677.13 year to date, and then that's a variance of $2,316,598. So moving on, we have the balance sheet where we have the assets with all the various bank accounts. I'll be going through the reconciliations very quickly, and then the tax receivable and some allowances. So, but again, this shows our total fund balance here of $10,372,000. Now, this is our bank reconciliations. This is the general account where we take in point of sale receipts from environmental health up in the clinic and vital records. And the adjusted balance is 663, 513.72. And that's just some of the backup on that. Is now going on to page 31 is our lead account, which is a special deposit account for our HUD grant. And our balance in that account right now is 145,875.69. And then on to page 34 is just our abandoned properties account, and we're just starting up with some demolitions, so we don't have any activity. We just have our $5,000 minimum balance. And then the last account we have is our ePay, which is on page 37. And this is where we get our web-based payments for all the birth certificates or fees, whatever people don't want to pay at the counter. So, and that's an adjusted balance of 320,260.79. So, are there any questions on the banks or bank accounts? No, okay. All right, and this is on page 40 is a detail of all the revenues and expenditures by category. One of the items that were kind of a delta from last year is our food service permits. We've kind of had on hold the collections. We have a $600,000 budget, but we've only collected 101,000 at this point. But in summary, our expenses for the date are 8,477,000 in revenues year to date and 8,837,000 in expenses. So we're running a $360,000 deficit compared to our year to date budget of 489,000. So things they're running pretty close to plan at this point. And then on page 43 is our emergency reserve minimum graph, which is the red line there indicates the minimum that we should have on hand, and in the event of an emergency. And it seems like we've been in a state of emergency forever. But in June, we actually have just a little over 9 million, which it's higher than it was last year at this time. So it both last year and this year kind of run similar, but we're just doing slightly better cash wise, collection wise. So we've been able to get our reimbursements in and paid fairly timely. So, and this is a list of the accounts receivable for our various grants with a total down here at this point in time, 1,341,000 due from grantors based on various programs, billings, and our collections. And then the mass vaccination grants here on the bottom, we got a lump sum right away of 725,000, and we still have roughly 300,000 in service to perform on that. So that's a deferred revenue or a liability on our part. So are there any questions on any of this? I know there's a lot of numbers, and if there's anything you want to don't understand or in particular, happy to answer it now. Or
maybe just for clarification on the population vaccination grant, we're not paid per vaccination. That's monies that was related to staffing, purchasing that of allowable expenses outside of that. So it's not like we do not get reimbursed per vaccination. It's expenditures that we submit. And again, we've been fortunate to have the guard unit with us, so that really has helped us kind of offset some of that.
Okay. All right. And now we're to the proposed major expenditures, Mr. Powers.
Okay. As people may remember, when we have finance committee meetings and we review the various expenditures ahead of time, we're able to move through this a lot more quickly than we're going to be able to move through it tonight, where we're able to do it and have you just approve all of the expenditures at one time. Since we didn't have a finance committee meeting, which is unusual, we will need to take them item by item tonight. So sorry to take you through all of these different items, but that's the reason for it. Okay, the first item has to do in terms of vital records with the Illinois Department of Public Health. It's for the fee for the electronic filing of death certificates for June of 2021. The amount is $7,996. Do I have a motion to approve this?
So moved.
Do I have a
Second.
motion and second? Any discussion? All those in favor, say aye.
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 Opposed? Okay. The next item is, in terms of vital records, is the security bonded paper for birth certificates and death certificates in the amount of $7,898.30.
I move approval.
Second.
Any discussion? All those in favor say aye.
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 Opposed? Motion passed. The next one is in terms of the teletask message service for the WIC tech service and appointment reminder service, which is in the amount of $3,155.
I
move approval.
Do
Second.
I have we have a motion and a second. All those in favor say aye.
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 Those opposed? Motion carried. The next one is the Winnebago County soil borings analysis in the amount of $4,525.
Move
approval.
Do I have a second?
Second.
Okay. Any discussion? All those in favor say aye.
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 Opposed? Motion passes. In terms of the next one with Adobe Pro, that's the Adobe annual licensure of products in the amount of $4,438.44.
I move approval.
Second.
Any discussion? All those in favor say aye.
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 Opposed? Motion passes. And the final one of major expenditures is KMK Media in terms of a video production on oral health prevention in the amount of $8,000.
Move approval.
Okay,
Second.
second. Okay, any discussion? All those in favor say aye.
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 Opposed? Motion passes. Okay, we have now gone through the major expenditures. And now we will go through our long list of proposed contracts and agreements. The first one is for KP Counseling and the Solace Program for the treatment and the client referral of TB patients. It's new, there's no actual amount. Do I hear a motion for approval?
So moved.
Second?
Second.
Okay, any discussion?
I have a question. Why is there no amount listed?
It's basically because it's simply an agreement rather than one that has a financial amount attached to it.
All right, so we're not reimbursing KP. Okay.
Right, good
Okay.
question. The next one is the Zoli Vlock for the supervision of the McChief staff in the.
Want to vote on that last one, Jim?
We didn't vote on the last one, I'm sorry.
I'm sorry, my apologies, in the midst of a lot of items. Do all those in favor say aye?
Aye.
All those opposed? Motion passes. The next one is the Zully Vlock, in terms of the supervision of the McBeef staff in the amount of $14,400.
Move approval.
Second? Okay. Is there any discussion? All those in favor say aye.
Aye.
All those opposed? Motion passes. For the University of Illinois College of Medicine, in terms of the clinical consultation with respect to drug overdose prevention program, in the amount of $7,800.
Move approval.
Second.
Okay. Any discussion? All those in favor say aye.
Aye.
All those opposed? Motion carried. For the Illinois Housing Development Authority, the Abandoned Residential Property Municipal Relief Program in the amount of $75,000.
Move approval.
Second.
Any discussion?
We know what this is?
Would we want to ask Todd about this, Sandra? Todd Marshall? I'm not sure. Sandra, can you fill us in?
Todd Marshall?
Yeah.
Yeah, this is your abandoned properties.
Oh, the 75, is it $75,000? Yeah, the abandoned
Yes.
properties, round 5. We were awarded $75,000, which is another tool in the toolbox for us to address blight properties in Winnebago County. Actually, it's a little more versatile. It does allow us to spend some money for cleanups and things like that. But ultimately, we've always used it to get the houses down. And obviously, that's a big task, and any money that we can get is very helpful.
Okay, does that answer? Okay.
Yeah, so
Any
so we
other-
got reimbursed for all that, so,
We get the money on this one, right? We're not
Right.
paying.
yes. but it's-
Okay, any other questions? All those in favor, say aye.
Aye.
Those opposed? The motion passes. The next 4 have to do with the tobacco prevention program. The first is for the Roscoe Police Department, the tobacco prevention program in the amount of $1,141.
Move approval.
Second.
Any discussion? All those in favor, say aye.
Aye.
Any opposed? Motion passes. The Winnebago South County Sheriff's Department, that tobacco prevention program in the amount of $1,262.
Move approval.
Second.
Any discussion? All those in favor say aye.
Aye.
Any opposed? Motion passes. For the South Beloit Police Department, that tobacco prevention program in the amount of $1,029.
Move approval.
Second.
Okay. And any discussion? All those in favor say aye.
Aye.
Any opposed? Motion passes. For the City of Rockford Police Department, in terms of the tobacco prevention program, $11,019.
Move approval.
Second.
Okay. Any discussion? All those in favor?
Aye.
All those opposed? Motion passes. And the final one in our long list, item I, terms of the Roscoe, Village of Roscoe Police Department, the Narcan spray training delivery. There is no amount attached to this. It basically is an agreement. Do I hear a motion for acceptance?
I move
So
approval.
moved.
Second.
Any discussion? All those in favor say aye.
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 All those opposed? Motion is carried. That ends contracts and agreements. And I think that ends the finance department.
What about fiscal year 2022 budgets?
No, Jim will be presenting on, this is the board meeting in which we review and approve the budget for advancement to the county board.
Right.
Okay. So, yeah, on page 143, I kind of have a schedule of our anticipated revenues for fiscal year 22. You can see on the bottom total for fiscal year 2021 was 14,383,000. Now, the major difference is the contact tracing grant that kind of was quite a substantial change from 20 to 21. We're going to wrap this grant up at the end of the calendar year and have about 420,000 activity for that particular grant. So between the schedule of all these grants and the fees that we collect, we anticipate revenues of approximately $10,880,000. So there's program by program kind of identified there. So and then our major expenses here are obviously the manpower and related benefits. So on page 144, I have a listing of all the positions that we have for the current anticipated wages, and then a proposed cost of living adjustment midway through the year, and then a total on the right-hand column. So on the bottom of page 144, we have a grand total of $5,780,000 in wages, and that's for permanent employees with the total FTE of 105.3. Some part-time people buried in there. Now on the top of page 145, I have the permanent wages that we had in 20, permanent wages we had in 21, which went up 4%, and then in 22, with our budget, we anticipate an increase of 2.1%. So in wage expenses, and then these other wages down here would represent temporary wages of $336,000 for those people finishing out the contact tracing grant up through the end of calendar year 2021, but our fiscal year 2022. So, and then so if you look on the page 146 on the right-hand column, you'll see the regular salaries there, $5,780,000. That's like the second line down. And then the temporary salaries and some overtime. And so the personal, the gray bar is $7,907,000 in wages and benefits based on the budget that we have. And then the next category is supply and services, which covers support services and medical and dental supplies and consulting and all these other expenses that are delineated, and with a total expenses up here of $10,779,448 for fiscal year 2022. So on page 150, we have the the summary. So our 2022 budget would be revenues of 10,879,683, expenditures of 10,779,448. So we would be planning for a surplus of $100,235. So in excess of revenues over expenditures. Are there any questions on any of that? I know I kind of went through quickly, but we did deliberate in finance and committee 2 weeks ago. But
I have a question, just with, for someone with some institutional memory. What was our high as far as full-time employees? Does anybody remember?
I think we have a slide on it coming up.
Oh, okay.
Yeah, in the narrative.
In the narrative, yeah.
Yeah. So
I think that slide doesn't go back to our absolute high.
No.
Okay.
Because our high was earlier than that. That covers the years that we've cut down.
Yeah, I think when they had laboratory services and other things, I think it was.
I thought I remember seeing something, Pat, was there something in the 300 or something like that?
That's too high, but it was certainly
200, I'd say. It was probably 200. Been here a long time, yes. I think
something in that range. I would agree with Todd.
Yeah, it was more than just 200 though, if I remember. But that's amazing. I mean, more than half cut.
Well, we have to remember the things that we outsourced or moved to do with the county and some of those things too. And so it's not just that we've shot down on numbers in every place, but some things we're just not doing with our own employees anymore.
Right. We're not doing as much clinical work instead. Yeah.
And I think that, you also have to go, this is not, I'm going to say this is not uncommon. You've seen the debate regarding underfunding public health infrastructure, which is why temporary grants have to come in when you think about contact tracing and things like that. That we had.
So we have some competition on this Zoom broadcast with the weather from the local channel or something like that. And I'm not sure where that's at, but maybe you could silence the TV or your own transmission.
I'm not seeing where it's popping up on anything.
Yeah, I am not either.
Yeah.
Well, maybe we need to talk over it.
Okay.
Until we can.
I think we got it. And Trix, the royal dog, has said okay.
All right.
Are there any other questions for Jim? Okay, do I have a motion to accept the Department of Public Health's 2022 budget? Do I have a motion?
So move.
Second.
I have a motion and a second. Any further discussion? All those in favor, say aye.
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 All those opposed? The budget for the Department of Public Health is passed. And now we have the budget for the 555 North Court.
Okay, it's on page 151, and we're anticipating rental income between the health department and contact tracing and our various dentists and psychologists to be $466,407 for fiscal year 2022, and then expenditures for utilities and maintenance and depreciation of $450,580 with a slight surplus of $15,827. So.
Any questions for Jim? Okay, Do I have a motion to approve the 555 North Curse Court budget for 2022?
I would move that.
Do I have a
Second.
second? Okay, any further discussion? Okay, all those in favor say aye.
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 All those opposed? Motion is passed. Both budgets are passed. Our last and final, I think, item at this point is item number 6, which is the resolution authorizing the participation in abandoned residential property municipal relief program grant. And I think I return to Todd Marshall to tell us something about that resolution before we are able to authorize it.
Basically, in that resolution, if I recall, that we were in round 5 and we got an extension to do round 4. I would have to look at the agenda, and I apologize. But is this resolution for the extension? I'm sorry. Here, let me get on it.
No, it's for the new. This
Is
is
it for the new- it's for round 5. So this would be our 3rd consecutive awards from IDA to get this grant. And it's for that $75,000. And the resolution allows us to pass it up to the county board, but it gives all authority to Dr. Martell. That's basically what that resolution
Allows us to implement the grant, and it's required under the IDA.
under IDA, Illinois Housing Development Authority.
Because we're not our own local unit of government. So they have to grant us by resolution the authority to work.
Okay. Are there any other comments or questions in regards to that?
Is this the monies that we use to take down the abandoned properties?
It's
Okay,
the grant that
that's-
you approved as a major when you approve the contract.
Just wanted to get straight.
So do I have a motion to approve this resolution, which is authorizes this further participation in the abandoned residential property municipal relief program grant?
So move.
Second.
Okay, do I have any further discussion? All those in favor say aye.
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 All those opposed? Motion is passed. And we are through with a very long financial budget. So thank you for bearing with Jim and me as we worked our way through that. I appreciate it.
Well, I appreciate you going through it for us. Policy had nothing as peers and personnel.
Okay, we have 2 items. The first is the approval of minutes from our July 14th meeting. Is there a motion to approve?
I move approval.
Second? Any discussion? All those in favor?
Aye.
Aye.
Opposed? Okay, the minutes are approved. Item number 2, which is the Public Health Administrator's Review, we will move that down to executive session. And that's all I have on that.
Excellent. Nothing under quality. Any new business? Correspondence?
Probably just to give a little update on ChemTool. Just to, so the group is moving along. We completed the first phase of the health impact survey. Just so the board is aware, we used our Qualtrics platform to kind of send out, we're talking about the kind of fire suppression phase has been completed. The environmental health impact is kind of survey and studies are still ongoing, but the preliminary data has been promising in the sense of nothing that would cause concern at this point. So part of the kind of follow-up was the health impact survey. So we did leverage our purchase of the Qualtrics system and use the same platform. And we had we were able to reach out to over 2,000 respondents completed the health impact survey. So Dr. Helen, just as a follow-up, was a question on pets and livestock. So there'll be a separate pet and livestock survey going as follow-up, and another one on those who actually received health care. So that was kind of one of those benefits of a system that we purchased for one that we were able to leverage really from a standpoint. So there was a tremendous work done by really our epidemiologist, Abby, with Peter LePayton, and to really work through the survey questions. It was really the CDC's first attempt at a self-administered survey as well as part of this. So we are doing some groundbreaking work in that area. We hope to have some preliminary, but obviously we're just in the data collection. So we're continuing through those responses and phase. So just wanted to bring you up to speed.
Okay, thank you. Anything else? Okay.
I have a question.
Yes.
The iPlan prioritization Zoom meeting. I'm not clear as to what that is.
Sandra?
Yes. This was part of the final phase. Every 5 years, we are required to do a community health assessment and community health improvement plan. And so we started this pre-pandemic. There's 4 assessments that have been completed. And now it's as part of the exercise we went through with the county board already, and with some of our school administrators in a process of where you will be looking at what came out as strategic issues and the prioritization. So it's about an hour and a half of kind of a little overview of data, and then an exercise to assist us in planning and incorporating the strategies for what we are going to be working on over the next 5 years.
Thank you.
All right.
Excellent. Any other questions? Then we'll go into executive closed session.
I move we go into executive session.
Second?
Second.
Excellent.
Roll call.
I know we have to do the roll call, but it's in accordance with.
So
Yeah.
now is it this when I take it off of Zoom?
Yeah, Katie, do you want me to send you a text when we go back out and adjourn?
Yes, please.
Okay.
Can you do the roll call vote?
We will.
Okay.
Roll call vote, aye.
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 Okay.
You may want to explain it to Jennifer.
Yeah.
I'm looking for Jennifer picture. There she is.
Yeah.
So when we discuss more sensitive matters and personnel matters,